Okay, maybe we will get started. So hello, everyone. Welcome to the Temerty Innovation Grants Information Session. My name is Zoriana Salo, and I am the Center Manager for the Temerty Center for Artificial Intelligence Research and Education in Medicine. For short, we call it T-CAIREM. At this time, let me introduce you to two T-CAIREM research co-leads who will speak to you about the innovation grants. Dr. Anna Goldenberg is the research co-lead at T-CAIREM. Dr. Goldenberg trained in machine learning at Carnegie Mellon University with a postdoctoral focus in computational biology and medicine. Her research is currently focused on developing machine learning methods that capture heterogeneity and identify disease mechanisms in complex human diseases, as well as developing risk prediction and early warning clinical systems. Dr. Mazwi is also the research co-lead at T-CAIREM. Dr. Mazwi completed his cardiology and critical care fellowships at Children's Hospital in Boston with the Harvard Medical School. His clinical appointments are as a staff physician in cardiology and critical care medicine at the Hospital for Sick Children. His research roles include the William G. Williams Directorship in Cardiac Analytics and co-leading the AIM, Artificial Intelligence in Medicine Initiative. Also with us today, we have Dr. Jaky, who is a TechForward Fellow in Artificial Intelligence with the College of Family Physicians of Canada. Some quick information about T-CAIREM for those of you who may not be familiar with our center. T-CAIREM is an interdepartmental center at U of T that serves as a focal point for collaborations among healthcare providers, trainees, researchers, computer scientists, engineers, and industry to advance healthcare through artificial intelligence. You can become a member of T-CAIREM by completing a form on our website. Now, Dr. Kueper will provide an overview of the Fafm and the CFPC.
Great, thank you so much. The Foundation for Advancing Family Medicine is, as it sounds, all about advancing family medicine. And it's done a lot through various research and educational initiatives. And a lot of its activities and priorities align with what's happening at the College of Family Physicians of Canada, or the CFPC, which is responsible for setting standards across Canada for family medicine. But in addition to sort of this standard setting type work, the college is also about supporting the discipline and physicians through various initiatives. So again, through education, and then also through things like championing, advocacy, and research. So we're super excited to be partnering with T-CAIREM to help support the discipline through AI and family medicine. So I think I'll hand it off now.
Next slide, please. So the goal of this innovation round is to identify proposals that propose new technology that will transform the field of medicine through the applications of AI going forward. We would have loved to give more grants, but this time around we're giving two grants. One is an innovation open call, and one is an innovation grant with applications to family medicine. Next slide. The family medicine grant is a very similar grant to innovation, except in the field of family medicine. It's the same. Next slide. The details of what we're offering. There's one open call grant, as I said. It's 100,000 total value for a period of 1 year. I think there can be a no-cost extension up to 2 years. The deadline application is September 30th. And the proposal should be submitted through our online application form on the website. The same goes for the family medicine grant. Exactly the same parameters, $100,000, 1 grant, 1 year with the possibility of extension, the same deadline. It's just the focus should be on family medicine.
I'll quickly talk about eligibility and evaluation criteria. So the PI must have a T-CAIREM affiliation and be able to hold grant funding at the University of Toronto as a result of having a U of T faculty appointment. we prioritize interdisciplinary project teams, and that's both ideally teams that are collaborating across disciplinary silos in research, but also potentially at different points in disciplinary training. And so the inclusion of residents, students of varying kinds in your proposal is very much encouraged. Interested in projects that take novel approaches to data integration, utilize innovative methodologies, and basically apply these techniques to novel problems. You can only really submit one application as a PI, but you can be a co-I on as many applications as you would like. Importantly, for the family medicine grant, either the PI or one of the co-PIs must be a member of the CFPC. So that is an important constraint for those of you who are going to be applying for the family medicine grant. Next slide, please. So quickly talking about essentially the evaluation criteria now, it's important to mention that these are subtly different between these two grants. For the open innovation call, it's a very balanced evaluation criteria. So, roughly even distribution between rationale, goals, objectives, research approach and methods, impact, team and roles, and then feasibility and project milestones and timelines. Next slide, please. These criteria are slightly different for the family medicine grant. Goals, objectives, and the innovative nature of the project and its alignment with the elements of the quadruple aim have a slightly greater weighting, so 25%. 5% of the evaluation criteria are how your project addresses EDI considerations. Research approach and methods is 20%, impact is 20%, team and roles is 10%, and feasibility and project milestones and timelines are 15%, with 5% of the criteria being around budget justification. Now, again, these specific sort of criteria and weightings are available on the website for you to review after this info session. Next slide. So the application review procedure, one of the things we're very proud of is we've been able to recruit a very talented group of people who are leaders in their field to be adjudicators. And the adjudication to project matching process is ideally also based upon the relevance of their area of disciplinary focus to your proposal. The goal is to provide you with as high quality a review as we possibly can in a way that facilitates the goals of your project, and if you are not funded in this cycle, ideally positions you to be successful in future cycles. After a review meeting between the adjudicators, a short list of applications are selected to receive targeted feedback. This feedback is meant to facilitate a response and rebuttal session that occurs in a presentation to the adjudicating panel, after which a winning proposal is selected. Decisions will be announced early in the new year. And I think the last slide is basically just reminding you of the fact that all of this information that you've just heard us present is available on the website. I wanted to re-emphasize what Anna mentioned about the application deadline, which is September the 30th. Next slide.
I can start. The all PIs need to be affiliated with the University of Toronto as their rubric by which you assess the quality of the proposals. So one of the PIs has to be a T-CAIREM member. The rest of the PIs can be from anywhere. And the project evaluation criteria have just been mentioned and also are on the website and are slightly different for the two grants. So be sure to look at the right one that you're applying for. International researchers with well-established collaborations with U of T allowed as co-applicants and managed funds. Only primary applicant needs to hold a faculty appointment at the University of Toronto. And that's where the grant funds will be deposited. And then the distribution can happen from there on. International researchers can be co-PIs and team members, but will not have direct access to funds, at least not on our end. Next.
Okay, so can African founders apply? Do you fund African research groups with Canadian ties? So there's important overlap between this question and the one that Anna just answered. The PI needs to hold a faculty appointment at the U of T in order to be able to control funds. But again, international researchers can be co-Is, co-PIs, and team members. Can residents be listed as co-investigators? We encourage this. The inclusion of trainees in your proposal will be looked upon favorably. As far as some samples of the types of projects we expect to receive applications for, in the last funding cycle for innovation grants, we got 65 proposals from essentially across the gamut. We have mentioned a few of the areas of focus for those applications here, just to illustrate the diversity of proposals. And I want to double down on this. For the open call, there is not a priority area. We are looking for your innovative, earth-shattering ideas that'll point us all towards a better and brighter future than the medicine we practice now. For the family medicine grant, I want to make sure that I just restated that important constraint. The PI or the co-PI should be a member of the CFPC. But beyond this constraint, we are interested in, again, you bringing your biggest and bravest ideas to how we can modify and make our healthcare more sustainable in years to come. Next slide, please.
Are these grants appropriate for a new project that has not yet started? We consider projects at all stages. So if you have, feasibility will be evaluated. So hopefully you have thought through how this grant, how this project will run and the impacts and everything. But yes, it's perfectly fine to apply for a completely new project. Again, high risk, high reward type of ideas are very welcome. Can projects propose expanded data collection? So we thought about exactly what this question implied. If the question is whether just expanding on the population study and collecting more data is being proposed, then it's likely not the primary focus of this grant, as we are looking for AI applications in the healthcare area. However, if some more data needs to be collected, and then for the purpose of applying AI, this will be considered. Now it's only a 1-year grant, so the feasibility has to be there to be able to do both. Can we use one project and apply for both family and AI and the innovation grants? Both are AI grants. One is with application to family medicine. The applicant should apply only to one stream, either family medicine or innovations will be considered only in one stream. If your grant is applied to family medicine, we recommend that you submit to the family medicine stream. It will not be considered in both streams.
Okay, so is the funding for protected time, and can it be applied for work on an existing grant? So funding is not able to be used towards the PI and co-PI salaries, but we encourage you to use this funding if it's applicable to recruit students or other skilled personnel. As far as an existing grant, if you have existing funds for a bigger and broader proposal that you are seeking to catalyze further in some way through the innovation grant, I would encourage you to apply. That might allow you to take on a more ambitious or more longer term problem. What stage are the suggested proposals expected to be at in terms of implementation? We sort of already addressed this question. Projects at all different stages of development from concept to implementation will be considered. But again, remember what Anna just said about feasibility and potential time constraints in considering whether your project is suitable. Next slide, please.
So we are finished now with the questions that came over the registration, and we will now take questions from the audience. If you have a question, please type it into the Q&A and we will answer it.
Zoriana, given that we have a reasonable amount of people, is it okay to raise hands and then just ask it verbally, or do we not have this?
I think so. Matthew, would we be able to do that?
Sorry, can you repeat that?
Can people ask their questions out loud?
If they raise their hand,
Okay.
and you should see under the attendees tab that their hand is raised, and then you would press allow to talk, and then they can unmute their microphone.
Okay, we have a question over Q&A, and maybe I'll just verbalize it. Thanks for the informative presentation. Would prospective trainees, incoming doctoral students, for example, be allowed to apply as PIs with their supervisors for either grant?
Zoriana, I can't see the questions, unfortunately, in the Q&A.
I can actually maybe address this one. So the question is would prospective trainees who are incoming doctoral students, for example, be allowed to apply as PIs with their supervisors for? Yeah, so I think if the incoming trainee doesn't yet have a U of T appointment, it would make a whole lot more sense for them to be a co-I, with the PI being whoever their mentor is at the U of T. Or their supervisor, but they would be encouraged to be co-Is, co-PIs, or team members on applications.
And Mjaye, there's another question. What is your definition of AI? Is it true machine learning, or are there a broader application to this term?
I think it would be more helpful if a person raised their hands and they were enabled to speak. I'm not sure there is a very clear gradation and boundary to between ML and, say, stats, or there are a lot of methodologies that cross the spectrum of this too. I mean, we have been thinking primarily of machine learning, but of course other. I don't know what the person is implying that would not be considered ML. Maybe some older techniques like expert-based learning. I don't know. It's still AI in a broader sense. So.
And I can. It looks like there's another question here. So for the scope of the projects in the open competition, how is that judged? Are projects addressing very specific clinical problems equally considered as projects that apply to broader population level questions? The answer is absolutely. You know, in fact, the projects that were funded in the last cycle were projects that applied to very specific clinical problems. So, you know, I would encourage you to put in applications basically in both of these categories, because both would be evaluated.
I think actually based on the last year and the applications we have already seen, it helps the reviewers when it is very clearly articulated what the impact will be to which population, what exactly is the question that's being solved. So if you are proposing a technique with no real clear application, people will say, well, we don't know if there will be an impact of this, right? So there is a great benefit to having very clearly articulated benefits of whatever you are proposing.
Sorry, can you hear me now?
Go ahead, Susie.
Okay, sorry about that. So I guess I'm just wondering, because I think at least as far as I know, like pure AI isn't actually that commonly used in medicine yet. So I'm just wondering how black and white of a definition that you're using, or if we're using sort of complicated statistics and you know, sort of one small part of it would be sort of like teaching the database in terms of identifying different categories of medications. Would that be considered AI, or is that not so much the focus of this grant?
So to comment on each part of your question, first of all, the fact that AI is not commonly used in medicine is not really an issue for this grant, because the proposal is to be the groundbreaking work for the next years to come. And it is being used, perhaps much less than is being written about, but it is being used. And but that's where the field is moving. And so our goal with this grant was to give a chance to those sort of higher risk, something that may be perceived as high risk by regular funding agencies, to give these projects an opportunity to be implemented and to shine. I'm not sure what you mean by sort of complicated statistics, but if the goal is to, this is not a method development grant per se. This is a real application of AI methodology to healthcare. So it's all right if you are applying existing methods. AI grew out of statistics to a large extent, so it is not. It will not be completely unreasonable to say that these methods are not valid or do not apply. I think the key is do we see the proposed approach as a sort of groundbreaking in its application, and something that the field will want to be using in the next 10 to 15 years. I think that's the question that we are trying to address. And will it really change the efficiencies or create new opportunities in the field due to applications of these methods? Is that helpful, Susie?
Yes, thank you so much.
Mm-hmm.
Another question about reviewing the proposal for budget if there's specific components. So that's one of the evaluation criteria for the family medicine grant. There aren't specific like lines that we're looking for or anything like that, but we're looking for alignment with what's proposed. And again, it ties into the feasibility and is it appropriate use of funds. So yeah, there's no like specific items we're looking for, but we will look for like, does it make sense? Is what you're proposing going to allow you to do the work? Are all necessary people there and supported and things like that.
You know, while we wait, I'm still thinking about Susie's question. You know, Susie, I would advocate that if you're sitting on the fence, you should definitely apply. You know, one of the concepts behind this adjudication process was for proposals that could really articulate this impact to provide applicants with another opportunity to make their strongest case. And sometimes that involves targeted recommendations from adjudicators that might influence in some subtle way the direction of the proposal. And so I think if you're sitting on the fence, we tried to design the application process to not be very onerous in order to basically encourage people to apply, and would advocate that you do so.
Just to answer that last question, whether the budget needs to be included in the initial application or in the presentations to the adjudicators in the second stage. So the budget should be included in the application with the initial application. The application actually has a specific section for the budget. So we do encourage you to include the budget in the application itself. There's another question. How detailed should the budget be? Anna and Mjaye, do you want to take this one?
I would recommend really quite similar to what you would submit to CIHR. This is to help us to assess the feasibility of the grant. And so the more details you put, who will be working on the grant, that they are properly covered, that etc. That would be appropriate, I would say. Mjaye, do you want to add anything?
No, I completely agree with that. I'll say that I also don't want you to be super preoccupied by that, because in both of the grants, even though it's going to be an important part of assessment of feasibility, you in all likelihood will have an opportunity, if your proposal is innovative enough, to discuss or describe that further when you interact with the adjudicators. Make it as detailed as you think it needs to be to accurately explain how you are matching funds to the proposed work. And the CIHR sort of template that Anna was proposing sounds like a very reasonable place to start. And that's more or less what applicants in the last cycle did.
So to answer that last question, a recording of this session will be posted on our website. So if you need to, you can go back and rewatch certain sections. And Mjaye, there's another question. Does it matter whether the PI is an assistant or an associate professor?
Does not matter.
Not at all.
Another question. The call mentions that the funds can be used to supplement existing projects. Can the same proposal be used for both, or does there need to be a novel component for the T-CAIREM funds?
So I want to make sure that I understand the question. So as I understand it, the question is, if you have existing funds, can you resubmit the same proposal as an innovation grant and supplement those funds? Is that correct? Because I think if that's the question, I would advocate that there needs to be some sort of novel component. If you've already been funded for work that you've proposed elsewhere, if there was some novel component that T-CAIREM funds would supplement and catalyze, then that would be eligible for funding. If you have already been funded and what you're considering is resubmitting the exact same application for supplemental funding, we would not consider that application. I'll say that the goal of the innovation fund here is again to sort of provide you with a high risk, high reward source of funds that might be difficult to get through other funding agencies. And so there would have to be something innovative.
If there's no other question, then perhaps we will wrap up our information session. If any questions come up between now and the deadline for the grants, please feel free to email T-CAIREM. You can find all of the information on our website. Thank you very much, everyone. And thank you very much to our panelists and presenters, to Dr. Goldenberg, Dr. Mazwi, and Dr. Kueper.